Hi, my name is Will Davis. I'll be presenting my senior thesis over water scarcity in grassland areas around the world. This thesis incorporated REPCO's 10 steps of the interdisciplinary research process to synthesize perspectives from nutrition and organizational leadership to form a more holistic understanding of the problem and discover some potential approaches to solutions moving forward. Water is perhaps our most precious resource. National Geographic estimates that only somewhere between 1 and 2% of Earth's water is available for us to use, and 70% of which is devoted to agriculture. According to the Food and Agriculture Association of the United States, the continents of Africa, Asia, North and South America create the most significant portion of the world's exported agriculture. These continents also have the highest abundance of grassland areas, and water scarcity in grassland areas is significant because communities in grassland areas don't have access to modern health care, and they rely on water for everyday life much more so than an urban community would, more than just consumption. And a lack of water creates instances of dehydration, waterborne illnesses and diseases from using stale or old water, the malnutrition from crops dying out, and dehydration. And so nutrition is a very relevant, if not necessary, discipline to utilize in researching the symptoms of water scarcity in grassland areas, because water is essential to the health of all living organisms, and lack of water not only can cause dehydration, but if crops die and there's not enough to sustain a community, then malnutrition rates increase, and nutritional health declines. And so I wanted to establish a connection between water scarcity and malnutrition. So the insights from my nutritional research showed that in studying grassland communities in sub-Saharan Africa, researchers established that there's a connection between water, food, and health in these communities, and they are intricately linked to each other, and that studying water scarce areas directly correlated to studying communities with high malnutrition rates. And similarly, research in the country of Niger, studying ambulatory feeding programs, so children that are malnourished. The most significant number of these children were coming from areas suffering from water scarce seasons. They made a strong correlation between the adequacy of water supply in these villages and malnourished children. So research in Ecuador, the grassland areas of Ecuador, used water productivity ratios and nutrition productivity ratios to study whether the specific nutrients that they found people were deficient in grassland communities were linked to water scarcity and their crops dying as a result of that. So the data from this research established the use of nutrition productivity ratios in studying grassland dense communities and their nutrition rates as it relates to their water supply. This established the links between water and nutrition security and specifies areas of focus for water management systems to improve nutritional health. And so nutritional water productivity ratios have been used in other research to establish the link between water and nutrition security, and was shown to be able to, for other environments around the world, to apply these methods of research to establish the ways that improving water in specific crops and in specific areas can improve the nutrition rates of entire communities. So where organizational leadership gets involved is it's one thing to establish a connection and establish nutritional data that needs to be improved for malnutrition rates to be improved, but the logistics of implementing new strategies to address those is difficult. So communication has to be efficient, implementation has to be efficient, and in governments and institutions that address this issue, organizational leadership is certainly relevant. In 2016, ATCR researched the GBM basin that separates the countries of China, Nepal, India, and Bangladesh. And communities in these countries all utilize one water source. And previously they were fighting over water resources. When water scarcity hit, the entire region suffered as a result. And his research suggests that using a cognitive community approach would improve the nutritional health of all of the communities in the basin to achieve everyone's water demands. And in 2008, qualitative data on watershed management projects in Ethiopia found that there was a disconnect between the government of Ethiopia and specific cities, specific communities outside of those cities, and smaller farming villages, because these new watershed systems weren't being properly explained to the farmers how they improved the entire community. And they were more complex, not as easy to use as the older, more traditional methods of conserving water. So they were abandoned by small farming communities and farming leaders because they didn't understand how utilizing these new projects would improve the entire area. And to them, it just seemed ineffective and pointless to be using more complex systems when their more traditional ways seem to work just as well, because they understood how to use those better. So Similarly, a research study in Texas by Van Dyke and King in 2017 observed the effects of engaging the public on new uh, solutions to water scarcity by the Texas water management districts. They found that when they disseminated information to the public, explained how taxes and resources were being used to conserve water, they were gathering more support and more finances to accomplish their goals, and significantly improved the efficiency of their water management planning. And so each of these studies, they validated the methods they use in either collecting nutritional data or observing organizational leadership strategies, and uh, they integrate well with each other in that research on nutrition provides leadership with an area to focus on to improve. And organizational leadership has the authority, the resources to implement effective plans to address those nutritional needs and improve existing watershed management projects. And so the data provided by the nutritional research on the efficiencies of water absorption strategies and its relationship with nutritional health provides more efficient methods of addressing the symptoms of water scarcity in grassland areas and their communities. These observed relationships and the potential solutions to improving them are complicated. They're difficult to explain and implement, especially in an underdeveloped community. So this is where organizational leadership will be especially effective in establishing clear communication, more efficient implementation strategies, disseminating information down the chain of command and to the public. And as a result, newer water management systems can be utilized that address the nutritional concerns of underdeveloped communities. They save costs on agriculture and healthcare, and the symptoms of malnutrition are addressed by utilizing this research and by organizational leadership developing more efficient water management safety plans. So this research shows that synthesizing these perspectives can form a more holistic understanding of the issue and led to some potential approaches to solutions for grassland communities to consider. This thesis also demonstrated that an interdisciplinary approach is effective in addressing complex issues. So moving forward, as water scarcity becomes a more global issue, I think that an interdisciplinary approach is certainly necessary. There is further research needed in addressing the nutritional concerns of surrounding communities and other organisms, because water plays such an essential role to the health of agriculture, animals, plants, you name it. And in the future, water management systems can be structured to address more than just grassland communities. So, thank you for your time, and I appreciate it.